Guys, Dr. Billakota here. Today we're going to be talking about pregnancy and epilepsy. There is no contraindication. You absolutely can have a baby if you are a woman with epilepsy. There are a few things to keep in mind, however. Number one is how you do about 9 months to a year in terms of your seizure control leading up to your pregnancy is going to determine how well you do during your pregnancy in terms of seizures. What does that mean? If on your current medication regimen you are not having any seizures, you are very well controlled for about a year, that is going to be a good indication that during your pregnancy you will also do well in terms of seizures, okay? Now this is data from the Australian registry, there's an American registry and a British registry. They're not as extensive as I think they probably should be, but again, that is the evidence that we have. So that's number one. Better seizure control going into pregnancy is going to lead to a better outcome. Number two, depending on what anti-seizure medication you are, the levels will need to be checked frequently, sometimes even up to every 4 weeks. This is going to be a discussion that you have with your doctor because it's going to be variable from person to person. Lastly, and number three, is not all anti-seizure medications have the same safety profile in pregnancy. In pregnancy, there is no drug that is fully safe. I mean, even aspirin and Tylenol have their issues, but there are certain anti-seizure medications that are better in terms of side effects for the baby and for you during pregnancy in terms of spinal cord and brain development, which is what we care about the most. So talk to your doctor about that. So those are the three things. Your seizure control going into pregnancy is a good indicator of how you'll do during your pregnancy. Number two, you might need to adjust your seizure medication doses. You will decide that by following levels. And lastly, talk to your doctor about your anti-seizure medications and the safety in pregnancy. Ultimately, pregnancy obviously is a very complex journey. It is something that you should have a high-risk obstetrician and your neurologist or epileptologist involved in, talking to each other and coming up with a cohesive plan for you. Because of that, pregnancy and epilepsy should be planned. It should not be a surprise. So keep that in mind. All right. So I hope that was helpful. If there's any other topics you'd like me to cover in the realm of this, I love talking about women with epilepsy. So please let me know. Otherwise, you can follow me at Dr. Billakotamd on all platforms, and we will chat at a later date. Okay. Bye-bye.